Hey, it's Dr. Trish Leigh. Today I have a neurofeedback expert answer to a question. And the question is about titrating medications or weaning or decreasing medications using your neurofeedback trend graphs from every session. Okay, so let's start at the beginning. You perform a QEEG brain map on a patient, and we're going to use an example of ADHD to get started. On the QEEG brain map, you see that this person has a very classic ADHD type of brain pattern. What that means is there's excessive theta use. So we'll just say, for sake of ease, 3 times too much magnitude of theta. Typically, when we see too much theta, there's also too much delta. So we might see 2 times too much delta and an increase in theta. You know that most times when a person has an ADHD pattern, they also have a comorbid anxiety pattern. So most times we'll see at least 3 levels of high beta magnitude also. So let's just say 3 times theta, 3 times high beta. Now, if this person is on medication, and let's just say a lot of medication for the sake of ease, and I'm working with a few families, educating them about how the medication affects their system. So I have a few families right now where the kids are on 50 milligrams of a stimulant medication. So that stimulant medication, when it is taken, it is designed to reduce theta, bring that theta magnitude down. At the same time, it simultaneously will increase beta magnitude. And many times that will also increase high beta magnitude. So if on the map, the person was taking medication, but you still see excessive theta, it means that they're using much too much theta brain processing speed, and they also have presumably had too much high beta in the first place, which is being exacerbated by medication potentially. So anyways, what do we do? So as the person is using neurofeedback training to decrease theta and decrease high beta, on the trend graphs from every session that you perform with a patient, you will see the levels of delta, theta, beta, and high beta, alpha 2, but you're going to keep your eyes on those magnitudes. When you see significant decreases in theta magnitude, then you know you are affecting change at the neurological level of that brain pattern. So when we see that theta magnitude reduce significantly, it is time then for that person to go back to their prescribing doctor, and you can use these graphs, and we collaborate with primary care physicians and psychiatrists all the time. Using these graphs inform the decision to decrease that medication. Of course, it's the prescribing doctor's choice, but of what milligrams to decrease it to. But 50 milligrams is a high dosage, and many times doctors don't even like to have people at that high of a dosage. They're happy to be able to bring it down. And as these levels decrease of theta, then they can bring it down without any backlash behaviorally in the person. And they'll also feel less anxious because high beta will decrease when that medication is not in their system. And we are decreasing high beta simultaneously anyway. So the point is, it's not a one and done process thinking about how to decrease medications for a person as part of a team. It's constantly evaluating trend graphs across the sessions and looking for demonstrable decreases in the levels that you care about. And for ADHD, it's typically theta and high beta levels coming down. So as you see those levels decreasing, then you can inform your patient who informs their doctor, and you can collaborate there too, that those levels are lower and the nervous system needs less of the stimulant medication to be able to feel the same that it did before with the higher levels of medication. Okay, I hope that makes sense, because that's really a very important part of what you can do as a neurofeedback practitioner in a collaborative team, is really be able to help people reduce the amount of medication that they take, which makes them feel so much better as their nervous systems are regulated. So I hope that helps you out so that you can get out there and change brains and improve lives. Thanks.